little message. Wonderful. So welcome everybody to the Elisabeth Kübler-Ross Foundation's Caregiving 101. I'm so pleased to have Christina Irving with us this morning, who is from the Family Caregiver Alliance. And Christina is somebody that when I was at Mission Hospice, we worked with quite a bit, both for our advanced care planning workshops and her expertise in that area and in all things caregiving. So I will be offering a little bit more formal introduction in just a minute. In the meanwhile, I want to just introduce the foundation to those of you who may be here for the first time. The Elisabeth Kübler-Ross Foundation is a not-for-profit organization that's been inspired by the life of psychiatrist, humanitarian, and hospice pioneer, Dr. Elisabeth Kübler-Ross. It's in the spirit of embracing all of life, which includes death, that we further Elisabeth's mission and vision through collaborations, education, and advocacy. And Elisabeth really, truly believed in the healing power of love as one of the best medicines that is possible. It's in that spirit that we offer these community education opportunities, both community conversations, our film series, and our author series. So thank you all for joining us. I'm going to introduce Christina Irving. She is the Director of Client Services at the Family Caregiver Alliance. She oversees the staff of the Bay Area Caregiver Resource Center, who provide direct services to family caregivers, including assessment, counseling, education, and support. She's been with the Family Caregiver Alliance for more than 13 years now, first as a family consultant, then as a clinical supervisor. She's received a master's degree in social work. Sorry about that. She's received a master's degree in social work from San Jose State and is a licensed clinical social worker. And Christina and I have worked together in a number of ways, and I'm just so pleased to have her here today. Christina, I'm going to ask you if you would be kind enough to just go ahead and introduce yourself. We do have closed live transcription, closed captioning on for people that may be having, I know that this is a tricky medium sometimes. So if anybody wants to put up in the chat while Christina's introducing herself where it is that you're zooming in from, that would be wonderful. And Christina, I'm going to turn it over to you at this point.
Thank you, Susan. And I'm so happy to be here with you all today. And as Susan said, we've worked together for a number of years. And so even though she's no longer with Mission Hospice, it's great to still kind of have that connection and in her new role and be able to kind of continue that work together in different settings. So again, as Susan said, I'm a licensed clinical social worker with Family Caregiver Alliance. I'll talk a little bit more about our agency later, but we are a nonprofit that works specifically with family caregivers. And so in addition to maybe sharing where you're coming from in the chat, as I get started, if you want to share what your interest is today, are you a caregiver yourself? Are you working with caregivers? Anything that you're hoping to get out of this conversation today, that would be great for me to hear. My goal today is for us to talk a little bit about what does it mean to be a caregiver? What are some of the challenges and stressors that caregivers face? And how to build up that resilience as a caregiver. For those of you who might work in the field, you know that this is a difficult system to navigate. And if you are a family caregiver, you really know the challenges of navigating the healthcare system, of managing that care. It is a difficult and often very long journey that many caregivers face. So hopefully some of the things we'll talk about today will give you some tips and ideas of moving forward, again, for yourself as a caregiver or for those caregivers that you might be supporting. And with that, I'm going to go ahead and share my screen. Definitely as we go, feel free to put any questions in the chat as you have them, any comments or thoughts. I'm hoping that we'll have a little bit of time today for discussion at the end for any additional kind of comments or thoughts that people have, and we'll make some space for that as well. So again, we're going to start with talking about what does it mean to be a caregiver? What does that look like? I've been with Family Caregiver Alliance. I really, Susan, probably need to update the bio you have. It's now getting close to 16 years of working specifically with family caregivers. And, there's a lot of different perspectives that people have about, well, what does that actually mean? Most of the time people think about the help with daily tasks, and that might mean making meals, helping with medications, helping somebody take a shower or get dressed or use the toilet. But there's also about half of caregivers that help with medical tasks. So administering medications, including doing injections, checking blood sugar, checking blood pressure, managing oxygen, tube feeding, all sorts of tasks that families didn't go to school for. This isn't their job. But this is something that they've ended up doing because they're caring for someone who needs that level of care. But not everyone identifies as a caregiver. Um, it's something that you kind of just end up doing because this is family, and that might mean biological family. It might mean family through marriage. It might mean family of choice, that these are people who are part of your community who you have stepped in to provide care for. And not everybody identifies as a caregiver. It's just this is what we do. And it can have this huge range of tasks, from helping with bills and grocery shopping to really providing total personal care for somebody maybe at the end of their life. So there is a massive range of what caregivers do. And so we want to make sure we're supporting caregivers from that entire range, and also helping families identify as a caregiver, because it is a different role. Your relationships have changed. Maybe this is a spouse or a partner that you're caring for, but now you are also in this role of a caregiver, where you may not be getting the emotional support back from that person. You may not have the person who you were able to make decisions with together, who you could divide up daily tasks. It tends to then fall all on you. And so how do we support caregivers through the course of their journey, help people reach out for support early, and not wait until people are overwhelmed or burned out? In these last 2 years, we've seen a major impact on caregivers because of COVID, because of the pandemic. Not surprisingly, 83% report increased stress. And amongst caregivers, generally, they're reporting pretty high stress to begin with. And we've seen an increase. And a lot of that is coming from the challenges accessing the medical system, the worry and concern about caring for somebody who's probably at higher risk should they develop COVID, not having the same support systems in place. And there's been fewer healthcare visits. And this is both for the caregiver and the person we're caring for. Early on, when there was a lot of concern about, people utilizing emergency rooms, not wanting to expose somebody, we had a client who called us and said, my mom had a fall. And I called the doctor and said, should I bring her into the ER to get her checked out? And the doctor said, don't. Just keep an eye on her. Just watch, make sure, she seems like she's doing okay. And that caregiver called us and said, how do I know if she's okay? What am I supposed to be looking for? So we put a lot of pressure on families to be the ones who are providing the care and monitoring someone's well-being. And these are not people who are nurses or CNAs or LVNs. They may have kind of earned some of that on the job training, but there isn't that background. So it's a lot of pressure for families. And more, we were hearing about caregivers just feeling more isolated. And that sometimes is a hard concept for people to always kind of recognize in caregiving, because kind of by nature of caregiving, you're often with another person. And so it's like, well, how can you be isolated when you're always around somebody every day? But they may, again, not have that same relationship with the person that they're caring for the way they did before. Especially if there's any sort of dementia or cognitive impairment. They're not necessarily having those same conversations and dialogues about how was your day and getting that support back from the person. But there's also a sense of isolation from their larger community. Many caregivers report feelings of abandonment, that people in their life who they thought would be there for them have kind of stepped back instead of stepping up into that role of support. Maybe friends who After being told, no, I can't come out, I don't have time right now, I can't get away, stop asking, and really kind of step away. And there's that loss of those relationships, not knowing how to get help from the people around them. It's really hard to say to somebody, I can't do this all by myself and I need help. Especially if there have been people in your life that when you have asked for help have said, oh, I can't right now. It's really hard for caregivers to continue asking, to know who to ask, how to ask, and sometimes just knowing how to allow help. When there are people that say, well, let me know if I can do anything for you, it can be hard to let go of that and let somebody in. Especially during COVID, that worry about bringing more people into the house was very real. But in general, you're with the person often all the time, you know them best and are providing a lot of care. To allow somebody else to step in and take over some of those responsibilities, yes, it might give you time off, but it can also kind of increase some anxiety and some worry about, are they going to provide appropriate care for somebody? Um, Even when there are multiple family members involved, sometimes that's helpful and sometimes it's not so helpful, or it just leads to other stressors around conflict of different opinions about how somebody should be cared for, where they should be cared for, what money should be spent on care. And just again, that loss of social supports, caregivers who maybe had to leave a job or cut back their hours, don't get to see kind of coworkers, don't get to get out and see friends, don't get to visit with other family members. So there's a lot of isolation that comes with caregiving. And it's really important for us to recognize that either in yourself as a caregiver or if you're supporting caregivers, because this is one area where we really want to look for solutions, and they're not always simple, but how do we find ways to kind of bridge this a little bit? One of the other really common experiences with caregiving that we don't always think about, and this may be a group, given how you heard about this today, who is more aware of this, but is all the grief and loss that comes with caregiving. And not just when somebody has died, but the grief and loss that caregivers experience while somebody is still living and still with them. Often this is the anticipatory grief, the grieving for what is to come, either for the death that is down the road because you're caring for somebody with a progressive or terminal condition, but also the grieving for the little losses, the things that somebody can no longer do that they used to be able to do. Grieving for when they don't remember who you are, or when they don't remember kind of major life events, when they are no longer able to take a shower by themselves, or they can't drive anymore, and you now kind of take on that role. So there's all these little losses that caregivers experience. And we don't have rituals related to the grief and loss of caregiving and of serious illness. We have those around death. We don't have them when people are in this caregiving role. And so people who have not been caregivers or haven't worked in that space often don't recognize it and don't understand it. And that one leads to more of that isolation for caregivers, but also can make them sometimes feel uncomfortable that maybe I shouldn't be grieving because this person is still here. Which raises this idea of ambiguous loss. The idea that somebody is there, but not there. They are still with us, and yet so much of who they are has changed. They are still my parent, spouse, partner, and yet I am also their caregiver. So it's this idea of there are some things that have stayed the same and other pieces that have changed, and with those changes are coming losses. And so it's having to live with this ambiguity of how do we grieve for what is lost and hold on to what is still there. And this idea of ambiguous loss came from Pauline Boss, who's written a number of pieces about it. And it is this constant daily challenge of letting go and holding on at the same time. but that is a lot of emotional energy. And that often is one of the things that caregivers talk about being the hardest. There's the physical tasks and sometimes the physical work of caregiving, but it's the mental and emotional work of caregiving that can be so draining and so difficult to do. And so trying to find that space to how do I take care of myself? How do I give myself the space to deal with all of these emotions? What makes it so hard is these feelings of guilt. I should be able to do it all. I should be able to take care of them. I should be able to be more patient with them. I should be able to get everything done during the day. I should be able to balance it all. I should be able to do it without getting frustrated. All of these feelings that caregivers have in terms of how they provide care. And so we often have to step back and try and reframe it from guilt versus regret. You know, guilt says I've done something to harm or hurt or offend another person. And it can be a healthy emotion in those moments because it tells us I need to do something to make amends, to say I'm sorry. Versus regret is the sorrow we feel about circumstances outside of our control. So I regret that I'm caring for somebody who has a progressive condition, who cannot be as independent as they used to be. And that might mean either I need to step in and do things for them when maybe they still want to be able to do them themselves. It might mean I need to bring in outside help sometimes because reality is I cannot do it all. And that is not about me trying to hurt or harm or offend somebody, but that is making the best decision I can given the reality of our circumstances. So is that something I need to feel guilty about? Or is it something I can say, I regret that this is the reality that we're dealing with, and I'm doing the best I can with that? But that's a hard feeling to navigate through. It's hard for people to recognize that they cannot do it all themselves. And especially when our family or our cultural values conflict with kind of what that reality is. When the cultural values say family takes care of their own, and yet you may be in a situation that says, I do not have enough support to do that because we don't have that extended family anymore, or they're so spread out, or I need to be able to also work for us to be able to live. How do I actually fully take care of my own? So there's all the kind of guilt and worry that comes with caregiving. And we don't have great solutions or fixes to managing that. But I'm going to share just a piece of just a line from a poem. There's a poet, an author, and former caregiver. Her name is Frances Kakagawa. She has written a number of books about poetry, which I would definitely recommend, because she can blend the kind of the surreal and chaotic with the beautiful aspects of caregiving. So there is one line from her poem called Imperfections. And it says, we are caregivers, perfect in our imperfections. And that's the piece that I think we really want to remember and remind ourselves as caregivers. The virtue of being in that role of a caregiver and the act of providing care and support to another person, that is being perfect, despite whatever imperfections there might be, the sense of I have to do it right. Because we are not going to do it right all the time. It's just not possible. It's not going to happen. So how do we recognize and honor that perfection in the midst of all of that? And so the framework I want us to kind of think about today, again, given that we're dealing with the realities of imperfect systems, our imperfect cells, often imperfect support systems out there, is how do we build up resilience as caregivers? And resilience can be defined as the process of adapting while in the face of adversity, trauma, tragedy, threats, or significant sources of stress. And if that doesn't often define kind of the caregiving reality, not much does. So it's how do you as a caregiver, or when you're supporting caregivers, support their building up of resilience. This doesn't mean that things that are stressful aren't going to bother you anymore, that you're just going to get over things really easily, but it's how do we adapt well so that we're not brought down quite so low each time that new stressor comes up. Some people will look at resilience in terms of bouncing back. It can be, but it's also the next time a stressor comes around, how do we not let it lay us down quite so low so that we're starting from maybe a little bit higher. And so even if we get knocked back a little bit, it's not as far. So we're going to look at it from these kind of frameworks of embracing healthy thoughts, finding purpose, connections, seeking help, and fostering wellness. And there's lots of definitions of resilience. And even within this, there's lots of different ways. It's about figuring out what works for you. There is no one size fits all for supporting caregivers. And so it's figuring out what makes the most sense for you and what's going to be the most helpful. But we want to start with this idea of embracing healthy thoughts. And often that means, how do we manage our anxious thoughts? There are so many worries and anxieties that caregivers have. All those shoulds that we just talked about in terms of needing to manage everything, do everything ourselves. So many times we've had caregivers worry about, well, what happens if they fall? I need to be with them all the time because they are a fall risk. And what if they fall? How do I make sure that they don't get hurt? What happens if I bring in-home help and that person doesn't do a good job and I wasn't there? What happens if I don't notice a change in symptoms? There's so many worries. And so we want to start to try and look at what are those thought patterns? How do we avoid kind of the overgeneralizing that nothing is going to get better? There is no help for me. How do we avoid thinking about the shoulds? And this is where, writing down automatic thoughts can be really helpful. What are the things that come to mind? And being able to stop and think about, is that true? So we've so often had caregivers say, I don't know if I'm doing it right. I don't know if I'm managing it okay. I don't think I'm able to kind of get it all done. And to be able to stop and say, well, what are the things you have accomplished today? What's gone well? How long have you been a caregiver? And sometimes they'll say, oh, it's been, about maybe 2 years, it's been 4 years. It's like, okay, well, so for 2 or 4 years, you've been doing this. They're still here. They're still with you. They're still alive. They're still cared for. Helping people recognize and reflect on the skills that they have gained, the things that they do well, and acknowledge that. We used to do these classes for caregivers of veterans, and we'd kind of be all over the place teaching them. And at one of the hotels one time, there's little notepads that are next to the desk, and I saw one and I brought it into the class when we were talking about kind of overgeneralization and people feeling like they weren't accomplishing enough, and that sense of, I have this to-do list that never gets done. And the little notepad next to the desk in some random hotel somewhere in the country, I can't remember now, said on it, accomplished list. Feels much better than a to-do list, doesn't it? And so we actually started the class with that and be like, to get here, and this was, I think, probably like a, 9 or 10 a.m. class, what are all the things that you got done? It's like you got yourself up and dressed. You probably got the person you're caring for up and dressed and breakfast and had medications. You might have gotten kids up as well. How much people get done, and yet they focus on the things that they weren't able to accomplish. So looking at how do we shift those thoughts around? And a lot of it comes down to, how do we help caregivers control what they can and let go of some of the things they can't control? And especially when you are caregiving for another person, often that thing you can't control is that other person that you might be saying they need more help, they need more support, they can't do these things by themselves. And that person may be saying, nope, I'm fine. I can do this all on my own. And finding that balance between someone's right to autonomy and their ability to make their own decisions, and you as the caregiver wanting to support them. How do we figure out what can we control and what can't we? And there was an article with a name that probably many of you might be familiar with because of his work, David Kessler, and this came out kind of early on in the pandemic, but it's so appropriate kind of to this place of how do we recognize what we can control and what we can't, and this idea of acceptance. And so he says, acceptance, as you might imagine, is where the power lies. We find control in acceptance. I can wash my hands, I can keep a safe distance, I can learn how to work virtually. And so for caregivers, what are the things that we can find control in? What are the things that we have to accept? I can learn how to communicate with somebody who has dementia. Doesn't mean I always get it right, but I can learn how to do it, and I can accept the fact that this is their diagnosis. I can learn to accept that this is not the same person that they were before, but to accept the changes that are happening in our relationship, in our environment. And so a lot of that acceptance is having to grieve and let go of the things that have changed, accept the reality of what is. And that gives us more of a sense of control. And that can help manage that anxiety, because then we're not trying to control the things that are just outside of our possibilities. So again, looking at our thoughts and whether those are helpful for us or tend to make our lives a little bit more difficult. And then that second piece is finding purpose. So I'm going to ask for any of you who either are caregiving now or have been, or if you've worked with a caregiver, what's something that caregiving has given to you in your life? Some sense of purpose or meaning in your life? What's a positive aspect of caregiving that you found? And people can share that in the chat. Any way that it's given their life purpose, meaning, value. Thoughts from folks. A new career because of caregiving. Yeah, we don't always think about that. We recognize often the changes and the losses of employment, but what are the skills? What are the values and the lessons you've learned that you bring into a new field? Making someone smile for a moment. Yeah, that impact of you being with them and a support to them. Helping to find your own values and becoming an advocate and offering resources. Yeah, there's so many things that as a caregiver you've learned, things that you can share with others, that those resources that are helping you in the care for somebody. Yeah, showed you what you were capable of. Absolutely. Again, and that's that piece of caregivers recognizing all the things that they're doing well, all the things that they've accomplished and how capable they are. And it's so much easier to acknowledge or think about the things that have been difficult as opposed to, no, what are you doing really well as a caregiver? Yeah, being able to kind of move into new fields, learning how to slow down and be present. Oh gosh, I mean, that's huge. That's also probably really hard for a lot of people, but to be able to really be present with somebody and connect with them in that moment and realize that is part of giving care. It's not always doing things. Sometimes it is just being with them. And the value and strength that your presence provides, whether the person you're caring for can acknowledge that or not, because sometimes they may not be able to, but being able to kind of be with them. Thank you all. So this is a really important part of finding purpose. And it doesn't necessarily mean that you have to pretend that every aspect of caregiving has been wonderful and rosy and you're so glad you got to do this. There are many times that people are caring for somebody who did not care for them. people who are caring for a parent who might have been abusive, caring for a spouse or a partner or an ex who the relationship ended, and yet they may be the only one in the position to step in and provide care. And so it doesn't mean you have to say this has been a wonderful journey, but is there something that I can take out of this that either highlights my strengths, my growth, something that has given my life meaning or purpose moving forward? Um, and it does not mean that I have to ignore the things that were hard, but how to learn from it and grow as a person for yourself. And again, this is hard to do when the caregiving situation has been particularly difficult. Um, but when you can say, I have learned how strong I am, how capable I am. These are new skills that I've learned that maybe I will take in another position or in another part of my life. Being able to recognize that, especially in the face of a really difficult caregiving journey, is such a sign of strength and is going to help build up your capacity to deal with the stressful aspects of it. Again, doesn't mean that they're not still hard and difficult and often very emotional, but it's what can you take away? What growth can you gain from something that maybe you wish you didn't have to have gone through? But does it give you some sort of purpose or meaning moving forward? And how do we help caregivers recognize that? How do you find that in yourself? And it's often a process. I'd say both for kind of looking at our healthy thoughts and finding purpose. This is where counseling can be so helpful. Having maybe other solid friends or relationships, often support groups, having that place where sometimes somebody can help hold that mirror up for you when you're having a hard time recognizing your strengths in yourself. Others might be able to support you in doing that. And then we want to look at how do we build connections. Sometimes this means engaging family and friends for help, maintaining those relationships with family and friends, trying to figure out how do we find some sort of life outside of caregiving in whatever way it can be. There's a number of care coordination websites, things like Caring Bridge and Cozy and lots of helping hands that help you loop in others who might be able to help or stay involved with caregiving. Where do you need to have family meetings? And some families can moderate theirs on their own. Others, you might think about needing to have it facilitated. Have somebody else who can lead those conversations so that you can still get that help and support in place. And then thinking about how do you still maintain those connections, knowing that isolation is so common with caregivers, how do we still hold on to those? And so it might be something like saying to friends, I'm not able to join you most of the time, but I really appreciate the invitations and I want you to keep asking. And I know it might be hard for you to hear me always have to say no, but I value this relationship and I want to hold on to it. I just may not have the time right now to fully participate. And to be able to say that to somebody, to hold on to those relationships and those connections can be really helpful. Finding support groups as a caregiver. And if we're talking about the one, kind of upshot to these last 2 years of the pandemic is that there are so many more support groups that are online. And that may not work for everybody in terms of having that really in-person interaction. But for many caregivers, it is much more convenient. You don't have to try and get away. You don't have to try and get out. So looking at support groups to be around other caregivers who are going through a similar thing, who kind of understand your journey. And there's a lot of great relationships and friendships that can come out of those support groups. And looking at community center or senior center classes, what's available for you to build new relationships, to build new connections, Again, to find things that are not just about caregiving, that are going to help you feel connected to your community and your supports. If you're involved in a faith community, making sure that you're reaching out. Many times we'll talk with caregivers and say, do you have a church or a faith community you're part of? And sometimes they'll say, well, I do. Do they know that you're caregiving? Do they know what's going on? And more often than not, caregivers will say, no, I haven't talked about it. And so how, as kind of those larger faith communities, do we make sure that we are bringing in caregivers and providing that space for that connection? But it often does take that caregiver being able to share what they're going through. We run a support group right now through a synagogue in San Francisco because they were finding that there were so many caregivers and they were like, we can't manage this. And so they had reached out to us and said, would you facilitate a support group? Because we don't have the skill set to do that, but yet we are hearing about so many family caregivers right now. So how do we make sure that we are bridging those connections and those supports for caregivers? And some of it is also, how do we help the person that you're caring for stay connected and engaged? How do we keep them busy and active? There's great programs like Well Connected, which is through Covia and Front Porch, which is phone-based activities, discussion groups. They have gratitude groups. So for people who maybe Zoom is not their thing, or they don't have access to Zoom, or the internet's not great, those can be options. There's things like the Alzheimer's store and time slips especially for people where there's cognitive impairment, about how do you create creative and engaging ways to keep somebody busy during the day. Looking for friendly visitor programs or friendly visitor calls that are often run by volunteers. Using programs like Caring Bridge to keep family and friends engaged. Finding any of those kind of virtual programs or things like adult day programs. Again, how do we find that engagement and that support for you and for the person that you're caring for? So those connections are really important. And then one of the other pieces of resilience is being proactive. And this really comes back to how do I take control? Not wait for things to come to me, but how do I start putting control in place so that I have less things to be anxious about or worried about? And this often comes from this idea of, what if something happens to me? If they're hospitalized and I can't be there with them. If I get hospitalized or injured, who's going to take care of them? So looking at what legal documents do you have in place? Do you have a durable power of attorney for finances so that you're able to manage their finances? Maybe someone's able to manage yours if you're not able to do so yourself. Do you have an advanced healthcare directive in place, again, for the person you're caring for, but also for you as the caregiver? Because if something happens to you, who's going to step in and manage your care? Do you have a PULSE form, or in some states, I know it's called the MOLS, the physician or medical order for life-sustaining treatment? Do you have those legal documents in place? Putting together a personal health record, and again, primarily for the person you're caring for, but if you have your own health issues as a caregiver, how do you make sure that this is organized as well? Having medication lists, doctor information, health history, insurance information, having it together and organized in some way, and having somebody else who is aware of it. Having something ready that can go with the person to the hospital in case you are not able to go in with them, if the COVID numbers are higher, if they're limiting visitors. Learning and getting connected to telehealth support so that you have those available as a resource no matter what happens. And this is for primary care, but there is also huge growth in mental health support and counseling. And for people who might live in a more rural area or an area where there is not a ready supply of counselors or therapists, accessing telehealth can be a great way to kind of get that support. I'm only going to talk about this next piece briefly, but it does come into, I think, when we're talking about being proactive and learning to seek help from other services and resources, is understanding how to pay for it. This could be an hour-long presentation in itself. So it's going to be the very high level understanding of it. So Medicare, it's mostly covering hospitalizations, maybe doctor visits, prescriptions. It does not pay for long-term care. It might pay for short stays in a skilled nursing facility for rehab purposes, but it's not going to be ongoing long-term care. So it's mostly Medicaid, which is Medi-Cal in California. It's going to have asset limits. It's going to have income limits, and that's going to vary a little bit state by state. But these are really important things to start looking at early so that you understand the eligibility and you can plan for it. There is something called the spousal impoverishment law that allows some protections for an at-home spouse to be able to keep additional assets and income. Again, what that looks like in your state may vary, but understanding what that is. So if you're caring for somebody who you are concerned about being able to pay for in-home or out-of-home care, you understand what you might be eligible for. Not many people have paid into long-term care insurance, but if you have, you really want to understand that policy way before you need it, because many policies will have an eligibility period, meaning the amount of time that you have to pay for care before the policy will kick in and cover it. And then you have to understand what is covered in terms of the type of care needed and who is allowed to provide that care. Can it be at home? And if so, does it have to be through an agency, or can you hire somebody privately? Do they have to be a licensed provider? Does it only cover assisted living or skilled nursing? Understanding that eligibility. And if you are caring for somebody who is a veteran, strongly encourage you to get connected to the VA, even if you think they're not going to be eligible for anything. Veterans who are service connected, so have a disability related to their military service, might be eligible for more benefits, but there are many that might be eligible for veterans even who are not service connected. There are certain pensions or financial help for paying for care for veterans who are lower income that may be possible. And then depending on what particular programs your local VA has, there may be additional respite programs or homemaker home health aides or coverage for adult day programs. So really starting to kind of look into those resources before you need it will help you kind of understand what's available. And again, seeking help, looking at those community resources in a crisis, when you're concerned about someone's well-being, adult protective services is always an option. The disaster distress helpline, this is through SAMHSA, this is a federal program through the Substance Abuse Mental Health Services Administration. And disaster distress is a hotline that you can call for any disaster. Pandemics, natural disasters, shootings, other kind of violent episodes, and it provides kind of that emotional support and connection to local resources. If you're caring for somebody with any sort of dementia, there's a 24-hour helpline through the Alzheimer's Association. The Friendship Line is based in California, although I don't think they turn callers away elsewhere. But it is a crisis and suicide hotline for older adults specifically. If you are in California, the Caregiver resource centers are always an option for you. So Family Caregiver Alliance is the Bay Area Caregiver Resource Center, but anywhere in California, there is an agency similar to ours. Elsewhere, you can go through the Elder Care Locator, or actually through Family Caregiver Alliance's website. We have a state-by-state navigator to find your local area agency on aging, to get information about the National Family Caregiver Support Program. It is national. Every state has it. What it looks like varies quite a bit, but the National Family Caregiver Support Program, it's a federal program under the Older Americans Act, and it's administered through your local area agency on aging. And the Elder Care Locator will get you to that specific program where you live. And what you want to ask that that area agency on aging is about options for respite. Respite is one of the programs under it, and there are different ways that people can get help. Some of it is hiring privately, through a home care agency or an individual. In-home support services is the program in California under Medi-Cal. In other states under Medicaid, it might be called things like personal care services, home and community-based waivers, elderly and disabled home care. It's going to have all sorts of different names, but if you're Medicaid eligible, there is a program that helps pay for in-home help. Understanding VA benefits, looking at adult day programs, which can be a great break for you as the caregiver, but can also be hugely helpful for the person that you're caring for in terms of getting more socialization and stimulation. And then many times, care facilities, so boarding care homes, assisted living, even skilled nursing facilities, will allow people to come in and stay for a short period of time. This isn't always the ideal for some people, but when caregivers are having health issues, if you need to go out of town, for some people, it can be a better fit than bringing in in-home care for that period. So it's just something to be aware of. Again, kind of understanding those options, thinking proactively about what are the resources and services where I live, how do I access that type of help, and looking into this before you need it. Because if you wait until you absolutely have to start using some of these outside sources of care, it's going to be that much harder to navigate because many of these unfortunately have wait lists depending on where you live, or they're going to have way too cumbersome or annoying application processes. And so starting to identify those before you need it and make those connections so that as a caregiver, you're getting that support and those resources. And then one of the last pieces of kind of building up resilience that I want to talk about is finding things that foster wellness for you. And this varies person by person. So often caregivers will say, I do not have time to take care of myself. And when they hear those comments from people that say, oh, make sure self-care, got to practice that. And caregivers will just say, when do you want me to do this? There is no time for it. So we're looking at what are things that foster wellness that can be done in short increments. And that might mean 30 seconds at a time. It might mean a minute at a time. It doesn't have to be the weekend away, although take it if you can get it. But what are things that, again, kind of replenish the energy that you are constantly giving out as a caregiver? If you think of yourself as a glass, and all your energy is kind of that water in that glass, you are constantly giving that to another person in that care that you are providing, in all the phone calls you're making, in all the help with medications or personal care. It's constantly giving out energy. And if you're waiting to have a big break to kind of refill that energy, you might be waiting a long time. So what are things that kind of drop by drop can help refill that glass on an ongoing basis? So those little things that you can constantly be doing. So I'm going to ask people to share in the chat, what are things that you do for yourself that are nurturing, that foster your wellness or give you a sense of peace or joy, even for a moment? What are the things that you do for yourself? A spa day? Yes. And this could be a spa day, going to a spa, get something, some nice or lotion, or do something for yourself at home if you can't get away. But again, if you can, go to those spa days. Oftentimes at home, yes. Again, it's what's realistic, what can you make work as a caregiver? So what else? What do people do for themselves that help you kind of replenish a little bit of that energy that you're giving out? Walk. Yeah. And exercise can be a great one for people. There's endorphins that can help us. Flipping through magazines. Yeah. Something light. Doesn't require a huge amount of thought, but just kind of takes your mind off of something else. A 6 a.m. coffee and reading an inspirational book to start. Trying to meditate. And I like that. Try. Yes. Meditation is hard. Like we know there's lots of good research and studies that show mindfulness in particular and meditation can be really helpful. It is a practice, but good effort for trying. Cute pet videos. Yes. I mean, talk about something that you can do in like 30-second, 1-minute increments that are just going to make you laugh and just bring some joy. Faith-based worship, prayer, sermons. Yes, tapping into your faith, both for the community and also for that sense of peace and purpose. Yoga, walking, exercise, reading, making candles and gardening. Oh, you've got some good ones. Yeah. So it's figuring out what works for you and how do you realistically fit that into your life. We have a 6-week class that we teach called Powerful Tools for Caregivers, and it's one that's offered kind of throughout the country. Different organizations are licensed to teach it. And each week, we have caregivers do an action plan of something they're going to do for themselves during the week that helps them manage their stress. And it's how often are you going to do it, how frequently. And the first week, one of the caregivers said, there's this one channel that I know does yoga, does yoga exercises, and I'm going to watch that so I can do it. I don't have time to go to a yoga class, so I'm going to just tune into this channel and I'm going to do the yoga with them. We're like, great, that sounds good. It's realistic, understanding she can't get away. So the first week she tried to do it, and she said that the channel she turned to was the wrong one, and it wasn't on. And so somebody said, well, I've got a yoga like DVD I can bring to you. And so the person brought it in, and then the next week she's like, oh, I just didn't have time. And I asked her, I was like, do you like doing yoga? And she was like, no, I don't. But she's like, but I know it's good for me to do. I was like, that is not the thing to do then. It's what do you like doing? Not the things, again, that you think you should do. Caregivers have enough shoulds. What do you enjoy doing that eases your stress, that helps you relax? That's what you want to find. And what can be helpful is noticing how you experience stress. If it tends to be in your head, if you're an overthinker, where you cannot quiet your mind, some people call it the monkey brain or the hamster wheel in the head. If you have trouble quieting the mind, finding things that engage your brain. So it could be baking, it could be reading, could be meditation. And that's the part that takes practice. It might be journaling, but something that engages your mind will help it shift from all those worries into something else. If you carry your stress really physically, the tense shoulders, the stomach aches, then physical activity is probably going to be particularly helpful for you. So thinking about, again, what works for you. As Susan mentioned walking earlier, there is some new research that comes out, and this really incorporates in some ways this idea of mindfulness and meditation, this idea of an awe walk. It's going out, could be a walk, it could just be sitting in a garden, backyard, in a park, but just appreciating kind of nature and recognizing the environment around you. So it could be trees, could be flowers, it might be the grass, could be birds, but giving yourself a moment to experience that sense of awe in nature. They have found to be particularly helpful in kind of easing stress in those moments. And again, this could be as simple as going into your backyard, going over to a park nearby, just looking out at some trees and just kind of appreciating that. And when in doubt and you have no time, taking a moment just to breathe. That when we practice kind of those moments of just deep breathing, it is that sense of meditation. It can help lower our blood pressure, just kind of slow us down. So when you're running from one thing to the next and you're just feeling overwhelmed, how do you take those moments to just breathe? I'm just going to kind of quickly mention FCA. We are one of 11 caregiver resource centers in California. We provide direct services through the San Francisco Bay Area. but we do also connect caregivers with resources nationally. We have a lot of online resources, of fact sheets, of videos and webinars, and those are available to everyone everywhere. The webinars are always recorded and on our website and on our YouTube channel. And then we also have CareNav, which is an online caregiver portal that provides kind of a brief assessment and personalizes consumer content, educational materials based on your caregiving situation and the type of resources that you are asking for. So it tailors some of the resources from our website and some of our content around personal care, around daily care tasks, long-term care planning questions, and self-care, and connects that together in a dashboard for you. So that, again, is available to people anywhere. So feel free to take a look at our website for kind of more resources and information. And I'll stick my contact information up as well. And then with that, I'd like to just take the last few minutes if there's kind of questions or comments from folks or anything else that you want to share in terms of resources or things that you found particularly helpful as a caregiver, or again, questions you have for me, or anything. I'll just kind of open it up. So if you want to put something in the chat, or Susan, if it's, I don't know, if you allow people to unmute and share, but either way, whatever.
Yes, yeah. I was just going to say, Christine, do you want to keep up your contact information? I will be sending an email out to everybody with this information. Let me just put your phone number in here into my file.
I will. I can put I'll put our website and phone number in the chat as well, so if that's easier for people to access.
Yes, and I'll also include that in the email. And so for anybody that might have a question or would like to make a comment, there's a couple of ways you can do that. One is you can just write it into the chat here, and I would be happy to read that out to Christina. Or if you want to just go down to the bottom of your screen where it says reactions, you can click on that little smiley face, and then you have the option to raise your hand, and then a little hand will show up, and that lets me know that somebody would like to ask a question. You know, Christine, I was just thinking, in here, I'm going to take down the screen share here since.
I'll stop that. Okay.
Yeah.
And I did see one question that came in the chat about our funding. So for FCA, it is a mix. We have some government funding through the California Department of Healthcare Services, through some of the local counties, so through the area agencies on aging. We are contracted to provide that National Family Caregiver Support Program. And then we also get private grant foundations and family foundation funding. So, you know, we are a nonprofit, so it is a mix of all the different funding sources that we can kind of pull together to deliver services. Because all of our services are free for families. We don't kind of charge. So it's how do we pull that together in different ways? And so again, no matter where you live, the National Family Caregiver Support Program is available. Just what that looks like, again, really does vary state by state. So I encourage you to take a look and explore those resources. And again, you can always go to our state by state resources on our website as well, and it will kind of provide some state by state guidance.
Christina, I'm wondering, somebody's asking about how to save today's transcript. You can do that by going down into the chat area, and where you're typing a message, all the way to the very far right, you'll see 3 little dots. And you click those. One at the very top of that drop-down menu says Save Chat. So you're welcome to do that. And we have another half hour for Q&A. So we have a question up with, let me see, Michelle is here. I'm going to drop Michelle down here. And Michelle, why don't you go ahead and ask your question? I'm going to get myself out of.
Hi, good morning. Thank you, Christina. That's a beautiful presentation. Felt it in the heart. My question is for caregiving with siblings. So I've witnessed this with my brothers and my good friends, and and their siblings, is like this went on for my mom for a good 2 years, where my middle brother was the caregiver of my mom, and the older brother was there and thinks he's doing his caregiving in a different way. They have different relationships. This also happened with my neighbor and her mom. And then the two siblings just grew apart. And I was like in the middle, the mediator. But how moving forward, like to help other families, any recommendations? I mean, and try to work, because they never spoke at all during the time that my mom was there. Now they're fine now after the fact, because I guess the burden of, the caregiver of my mom, even though she was an independent person. But any recommendations or suggestions as for other families that, and I witnessed this, it's the pattern.
Siblings are hard, on the one hand, we'll have some caregivers who will come to us and say, oh, I'm an only child. I have no one to share the care with. And they're like, it's all on me. We're just like, well, sometimes if there were siblings, it still might be all on you, but then you will also have the added conflict of multiple siblings together. Ideally, this is where these conversations start happening before somebody really needs a lot of care. In an ideal world, as families, and again, families kind of by biology, by marriage, or by choice, we would be having conversations about what happens if I can't be independent anymore and I start to need care. Who can be involved? What type of care would I want? What would that look like? And we have those conversations when we're all healthy and well. Unlikely to happen on a large scale, unfortunately. So most likely, as people begin to need care, this starts to come up. Family meetings can be really helpful, and I'd say do those early on if it's possible. Again, especially while the person who's needing care can be involved, and people can start to get on the same page. A lot of times the conflict can come from people having different understandings of the situation. So one person might be going to the doctor's appointments and be hearing most of the information, and they might think they're communicating that well to other siblings. And maybe they are, but it's not being heard in the same way. We all have relationships with our siblings from our childhood. Sometimes we get over those and it changes as adults, but we often carry that with us. Who is the responsible one? Who is the one who, is the smartest, or who's the one who's most caring? We all carry those, and it's hard to let go of it. Even if we think we have it, it's there somewhere. So trying to find a way to make sure that information is being shared and people are hearing it. So how do you have a family meeting early on to say, here's a summary report from the doctor because we got it in writing? Can we record the doctor's appointment visit so that everybody can hear the information that the doctor shared? Those can be some ways to start kind of making sure that there's a common understanding of the situation. And then having very honest conversations about what type of care can you provide. If somebody is working, 60, 80 hour a week days, or they've got really young kids at home, it might not be realistic to expect that they can step in and provide the same level of care or even regularly give that primary caregiver breaks. Now, should they be adjusting their hours or still stepping in? Some families might say yes. But can we allow space for families to create different structures? Maybe somebody is not able to step in as much, but they can financially contribute to bringing in outside care. And if that is a possibility, are the others willing to accept that and actually accept it, or is there still going to breed resentment? So having those conversations early can be really helpful. I'm going to stick in the chat a fact sheet we have about caregiving with your siblings. It was written with some help from an author, Francine Russo, who wrote a book called They're Your Parents Too. She did a webinar for us as well. So it's a number of years ago, but we do still have it saved, I believe, on our website. So it can be helpful. For family meetings, I facilitated some. Some go very well, where you've got siblings who they all good intentions and they want to work together, but they just, have different communication styles and different ways of doing things. And so it's just trying to create that common understanding and create a plan for moving forward. There are some family meetings that those resentments are too deep and they do not go well. And I've sat at a table with siblings and the swearing at each other starts. So they can go across the board. And so for some families where just even having a facilitated conversation is not enough, there are elder mediators. So elder mediators are doing mediation services, but not necessarily through like the court system, where we often think about mediation happening maybe in like divorces or in other kind of family issues. But it really is about how do they create these very structured formats for most often siblings, but really kind of anybody in the elder care area to have these conversations together. It's not a huge population of elder mediators, but there are some out there. So that can be a way to really create these kind of structured conversations. So sometimes that is what's needed as well. So I think it's kind of the different levels. It's start trying to have open conversations early on, create a family meeting with an agenda as needed. Then maybe you have to bring in a facilitator if that's not working. And then if even a facilitated mediation is not enough, or facilitated family meeting is enough, then think about mediation. And sometimes it is also this piece of what can you control and what can't you? And this is, I think, such a hard one for caregivers. I can think of a client of mine who was caring for her mom for a lot of years. And her brother occasionally showed up early on and then stopped. Didn't visit, occasionally called, did not contribute to the caregiving by time or by money. And so it was really hard for her both to take on the brunt of the caregiving, but she also was like, this is my mom's son, and he is not here with her while she is, at this point in advanced stages of illness and as she was dying. And so she was holding the emotion of both her own reaction and relationship with her brother, and then what it was like for her mom. And that was a hard process for her to kind of work through. I can't control him. I can't do anything about him. And I can be frustrated on my own behalf. But even with that, how do I let go of it? Because it's not doing me any service and any good to just constantly be annoyed at him for not helping. It's like, that at this point, he's not going to step in. That frustration, that resentment, very real, very understandable. How do you not hold on to it every day? Because that's just one more thing for you to feel stressed and frustrated about. And that's a process. It's a process of letting go and in some ways of grieving kind of that relationship. So it's how do we support people on that, give them that space to talk about it. And for some, counseling can be really helpful. For others, it's going to take time. Yeah.
Thank you very much.
Thank you, Christina. When you were speaking to Michelle, well, to everybody about this, I was reminded of, my own siblings. There are 5 of us in 6 years, and we have, we're better now as adults, but, for most of our life, we didn't agree on anything ever. So in anticipation, this happened during my father's dying. 2 of my brothers just were very attached to the idea that he should die as consciously as possible. And I had been at his house with my mother for 10 days with his acute leukemia winding up. And he was not comfortable. And he also, as I pointed out to them, he had never been conscious about anything in his entire life. It was unlikely that on his deathbed, that's when he's going to make this choice that they had hoped he would make. So there was quite a bit of friction. My brothers would not give them pain medication or the medication for anxiety. So even having them there, that still meant every 2 hours I had to get up during the night. And we determined that there was an advance directive that my parents had completed even in 1995, but they had locked it into a safe box, so none of their children had ever seen it until several hours before my father's death, when I asked, is there any possibility that you've written down anything? Like, would Dad have written this? So when they found out that my father had written down that just in case he might ever die, he didn't believe in death, that he should perhaps be unconscious for the whole entire experience. And so my brothers and I, at that point, it wasn't about, oh, you're so bossy, you think you know what's going on, which is probably a character trait of mine also. But in this case, it didn't matter because my father had written down what he wanted. So 20 years later, when my mother was heading for her 89th birthday, I had just completed again my own advanced directives, had updated them, and I thought, this could be very contentious. And so I'm going to just go up for her 89th birthday. Two of my brothers were going to be there. And I wrote an email and said, I'd like to share my advanced directives with you, with this group. Since you all live on the West Coast, you're most likely to be the people in my family that would respond. Well, my mother responded first and said, well, then I want everybody to know mine too. So we went up there and she was able, this was my whole purpose in sharing mine. I just really wanted to hear hers. And I wanted my siblings to hear hers as well. And she was just so articulate about what she wanted, but even more important, what she did not want. So when she very unexpectedly became ill and I thought she was going to die, which turned out to be true, and we all assembled there, even though there were times where I could feel that sibling kind of like, there was nothing to argue about. She had been so clear about what she wanted. That's all we could do. Like, at least we all agreed that whether it's something we would do for ourselves or not, she told us what she wanted. I tell people this is the biggest gift you can give your children. Talking about your death will not hasten it, just like thinking about winning the lottery will not guarantee that that's going to happen. For everybody that's like, well, I don't want to talk about this with my kids, your kids need to hear about it. You need to be able to say what it is that you want so they know what to do and that they are not fighting with each other during this time because it's already so stressful.
Absolutely. I think, the more we start these conversations early and normalize this idea of we are all going to need care at some point, those very few who, are going to live totally 100% healthy and independent until the day they suddenly die peacefully in their sleep. Those might be the exception, but for the majority of us, we are going to need some sort of care at some point. And so how do we have these conversations about what that would look like early is important.
Yes. I mean, really as early as you can consider thinking about it. And there's a saying in end of life care that it's always too early until it's too late. And that flips on a dime when it's too late. So there's a question here from Ayana. How can we reestablish independence once we step into that caregiving role? My siblings and I contributed to cradling my parents so much that it seems we're waiting on them hand and foot. They are capable of doing some of the things. I appreciate any feedback. Thank you.
Oh, boundaries and limits are so hard, especially if you've kind of set maybe expectations or circumstances in a way that is not going to be healthy for anybody long term. To suddenly change things is much harder. These are situations where I think it's really important to realize, like, who wants this to change and who is it not working for? It's working great for your parents. They have no incentive to want to do anything differently right now. I'm assuming based on what you're saying. So recognizing that they are not going to be in a position to be like, oh yeah, let Ayana and the others like step back. That's not necessary. It's like, no, it's working great for them. So just kind of, I think coming into those scenarios with that understanding can help give a little bit of perspective. And I would say then look at who your allies are. You can initiate that conversation with them and say, hey, I think, there's some things that we're not going to be able to do as much anymore. And we want to make sure you're safe and we still love and care about you and we're here for you. But I think there's some things that maybe you don't need us as much for anymore. And we want to be able to step back. Those are hard conversations to have. And again, your parents may not have the same incentive to go with that you might want. So looking at who else can you pull in? If there's things that you think they are capable of doing, is it a conversation with the doctor about what would be good for them to do on their own? A physical therapist might be a great resource to bring in, and let's do an assessment of what their functioning is. Because most physical therapists, occupational therapists, doctors, if somebody is safely capable of doing things for themselves, they are going to encourage that. that use it or lose it mentality with physical mobility. They are going to want somebody to do as much as possible. So they may be a great resource to encourage your parents to do those things on their own, maybe to offer assistive devices or home modifications if it's around physical safety that might support that independence. So again, pulling in some allies of who else can support you in stepping back and encouraging that independence, and also building out their connections and their support system. Some of it might be, oh, great, you all will do this for me, and I like that. It might also be here's the way I'm keeping this connection to my family, because if I need help with it, you are all here and involved in my care. So are there ways that we can make sure that those connections and those relationships between all their kids and them maintain outside of providing actual physical help? So I want to make sure that we regularly can do these dinners or do certain other outings or something that's not just kind of around the home. And are there other ways to build in other relationships for them so that they have other activities and things that are involved in their life that keep them socialized and stimulated? Again, it isn't just relying on the kids. So I think it's going to be a process, but I would definitely kind of pull in some of those allies and other people that you can. And you might start again, kind of with a doctor, with physical and occupational therapists doing kind of safety assessments and helping make sure that they know how to do things for themselves. We definitely see with some older adults when there's been mobility issues, if there's been a fall, that fear of falling again really means that people are either less likely to do certain activities or feel afraid to do them on their own. So I don't know if that's where some of this might be coming from as well, but again, how do we create a safe environment for somebody to be as independent as possible? Pull in if there's a social worker attached to the healthcare team, anybody who can support you in this conversation, I think would be really helpful, because that's a hard one. It's a hard one to have, to communicate, we love you, we're supporting you, we still want to be here for you. And you hear some of the ways that we need to step back a little bit right now. And here's how we will still keep a relationship and involvements in the future. Hopefully that helps.
Crystal is asking if you have any thoughts, how can healthcare workers, specifically in the ER, best care for caregivers and patients? Options are usually very limited in a crisis and emergent situations. So true.
Absolutely. And I love that question, because I think it's so important. So just thank you for even recognizing that. One I would say is just being able to acknowledge the caregiver. AARP pushed forward legislation that a number of states have adopted called the CARE Act. So it stands for Caregiver, Advise, Record, and Educate. So you might look at whether the state you have or the state you're in has that law passed. It's called something slightly different often in states, but AARP has it on their website. And what it says is when somebody's hospitalized, they need to ask, is there a caregiver? Document that in the chart, and then that caregiver needs to be involved in kind of discharge planning to receive appropriate training and information to be able to manage the care at home. So acknowledging the caregiver, listening to the caregiver's feedback about what they're seeing at home, because often caregivers have a very clear picture of symptoms, of changes, of challenges. And if the conversation is only geared towards the patient, you are missing this whole other perspective about what might be going on. So being able to kind of hear and acknowledge the caregiver's perspective, I think, is hugely important. Kind of recognizing them for that expertise and that advocacy they have is really helpful. Sometimes the simplest question, and I do recognize that simple question, but it doesn't mean that the answer might not end up being longer than you have, but just that question to a caregiver, how are you doing? Many caregivers have never been asked that, or not asked that by a healthcare provider. There's national survey data from the National Alliance on Caregiving and AARP, their Caregiving in the US report, and it's asked caregivers, how many healthcare providers have asked you about the help you need for the person you're caring for? how many healthcare providers have asked you for the help you need for yourself? And I'm trying to remember the numbers because I actually used them in another presentation. And it's something like maybe 26% have been asked about the help they need for the care receiver. And I want to say it's like 12 or 13% have been asked about the support they need for themselves. So just asking a caregiver, how are you doing taking care of them? How are you doing is hugely helpful. And I will try and stick in the chat. We created a kind of caregiver screening toolkit for healthcare providers. It was mostly a local outreach effort. So it does talk about our specific resources in the Bay Area. But as part of that toolkit, there is also a list of, I think it's like our 17 most popular resources. So if people are saying, I'm struggling with managing the personal care, it's like, here's our Caregiver College, the Home Alone Alliance videos. If they're struggling with dementia care, here's some of those fact sheets. If they're just emotionally struggling, here's some resources there. So when you're in that space where you don't have a lot of time and people raise issues that you're like, okay, now they brought stuff up that I can't do anything with. One, I'd still recognize the value of asking that question is probably very meaningful for the caregiver, but then being able to say, you know, I can't necessarily address that, but here are some resources, or having on hand, here's your local area agency on aging phone number, call them about the National Family Caregiver Support Program. Just having a couple of those resources that you can direct and encourage caregivers to might be really helpful.
I want to just say too, Christina, that answer, it was so beautiful. We had Jessica Zitter in her film Caregiver, A Love Story, which I know you are very well acquainted with. She was with us in April. And for those that don't know, Jessica Zitter is both a palliative care and an ICU doctor that has a number of films that she's made. Caregiver, Love Story is one of them. And she said she was actually making a film about her friend who became a hospice patient. And when she did all the filming and we were looking at it in very rough cut, I think that it was then that she realized this isn't a film about hospice, so this is a film about caregiving. And she also realized, as a palliative care physician and an ICU physician, you know, this realm of caregiving had been something that she did not understand at all. So acknowledging that, and now it's a conversation she does have with patients and their family members. So to Crystal's, you know, question and your response, for the healthcare provider to actually acknowledge you're the caregiver. What is it that you're seeing, since you are the person that you're going to be the best reporter about what's actually happening, and what supports, you know, here are some supports that you could easily access either online or with a phone call, and just even to have a handout to give to them, just to acknowledge that role. That's gigantic for people. Really, really huge. Ursula says here in the chat about communicating your wishes with documents, etc., with your children and family. She's an only child and had to find things regarding what she wanted, what her parents might want upon death and end of life. She said, as you're grieving and trying to figure things out while you're still trying to be a wife and a mom, that she is still handling her parents' things, even though they've died in 21 and 2020. So just that kind of support in advance of illness, to have these kinds of conversations. Things may change when somebody is ill, but if there's a big picture, like for my mom, no tests, no procedures, don't want to be in the hospital, want to be in my own bed, want to be out of pain, that's all I want, don't want anything else. Pretty simple. And to know that everything else that we were doing was operating around those main principles, what a freaking relief not to try to have to figure that out ourselves. Then Catherine writes, attention to the transitions around caregiving with siblings are key. It's easy to lose siblings one by one as caregiving for a parent goes forward. Support for one another is so important. Support not only for the one we care for, also ways to support one another, and how to do that are seldom addressed, which is also an accurate summation.
Absolutely. That piece of support for the caregiver. And so this is, again, I think really key for healthcare providers, for friends or families to recognize it's not just about how do we help you be a better caregiver? How do we help you provide better care to, your family member, your friend, but it's what do you need for yourself? How do we support you as a person on your own who is in this caregiving role? And I think that's also really important for caregivers to recognize. Sometimes the help you need to reach out for is not because you need help caring for the other person or you're incapable of doing it, but either at what expense to your own health and well-being, or just what support do you need for yourself? So it's asking for help for the other person and also asking for help and support for yourself. So it's something that we all kind of need to recognize in terms of how we support caregivers. And also for caregivers, I'd say when you're, reaching out and asking for help, which is good and important to do, recognizing that some of that might mean for you, and being able to say, I'm managing, I'm doing okay, I'm getting all okay, but I do feel like, I'm tired more often, I'm not sleeping as well, I'm feeling more stressed or more down, or, I'm just starting to notice maybe my health isn't as good and I might need more care for myself. And that is just as important as valuable to do. And it's also important to keep that in mind when making decisions. You might be accessing in-home care, using other resources, maybe using a day program, maybe considering long-term care in some sort of care home, not because you cannot provide that care, but you need it to be able to be healthy yourself. And that is just as important to take into account in the decision-making process as anything else. That your well-being is as important, and it can and should be a part of your planning process.
Especially because if something happens to the primary caregiver, then what happens to the person who's ill? This is a conversation I remember. I remember two families in particular. When I was when a volunteer coordinator, we were working closely with these families, and there was a lot of support from our staff. In both cases, they were men caring for their wives, and in both cases, the men died before their wives died because they did not do anything to care for themselves. And I recognized these men, like I recognized my father, my grandfather, and these men very stoic, like the way they were raised. This was just the way it was. You pulled yourself up by your own bootstraps. You took care of yourselves. They were raised, during a time of the Depression and then of World War II, where, those were really big things. So the idea that you couldn't take care of your wife was sort of this, I think in some ways for both of these men, it was almost like they felt insulted by that. But the reality is caring for another person full time is like the most extreme sport that anybody could ever engage in. It is taxing physically, emotionally, mentally. And there are a few people that can do that like just every single day over and over and over again with no other supports in place and come out the other end of that a whole, like healthy, grateful person. And so these caregivers, it's just, I used to think about the self-care as a caregiver as something extra that I did when there was time. It's essential. There's not time for anything else if I can't take care of myself, because the care I'm going to be offering to the person that I love is going to be so subpar when I'm exhausted and short-tempered and don't have my inner resources together. So I so appreciate everything you're saying about that. There's a question here. Do you happen to know if caregivers are allowed in hospitals and healthcare settings regardless of vaccination status?
I was trying to look at it. There's been a lot of talk around that, and whether hospitals, nursing homes can legally restrict family caregivers and what that looks like. And there's definitely been a couple articles, and I feel like there's been something new that came out that kind of addressed this, and I'm trying to see if I can quickly find it. If I can't right now, I will send it to you, Susan, to forward on.
Okay.
I think there was something that came out from CMS, the Center for Medicare and Medicaid Services, that addressed this, but there's also a lot that's in state by state and even county by county. And in most scenarios, even when there's been some kind of overarching guidance, there has also been some space that allowed specific hospitals or facilities to make to make other decisions based on certain safety considerations, but some of the overarching guidance was meant to protect the rights of families to be involved, as this idea that caregivers are not just visitors. It's like that really you are a part of the healthcare team. And if there is more advocacy around acknowledging that, then that means that needs to be taken into account with these sorts of policies. So I'm not kind of quickly finding it. I think I'm going to have to do a look for it when I can focus on it, as opposed to also trying to to be present here. So I will take a look. I will share it with Susan to pass it on to everybody.
Okay. Thank you so much, Christina. And I want to thank everybody. I'm noticing the time. We have just 1 minute left. So I'll be able to stay on just for a couple of minutes after this. I don't know that Christina, she's likely to have another meeting after this, but I'll stay on for a couple of minutes. There will be, this video will be sent to each of you that are on the registration list. That takes between 3 and 5 days. So I appreciate your patience with this. And on behalf of everybody at the Elisabeth Kübler-Ross Foundation, I just want to thank you all. I'm going to just put up in a chat. I hope to put up in the chat for those of you that might have an opportunity that might want to make a donation. I'll also include the Family Caregiver Alliance donation page when we are sending out the email. Just to know, the email is going to be coming from Eventbrite. It will have all the information and the link to the YouTube channel where this will be posted. So on behalf of everybody at the Elisabeth Kübler-Ross Foundation, I want to thank you so much, Christina, for being with us today. I want to thank all of you for joining us. And I just want to say that we are going to stop the recording. There'll be just a moment. You'll get a notice that the recording is ending, and then I'll be able to stay on. This will end the recording. Thank you so very much, all of you.